So today we're going to talk about the Wim Hof Method, and in particular a breathing technique that he uses. Now, I've been doing this with myself in totality, including the breathing and the cold exposure, for several months now, with great results on my own physical form. And I've been sharing it with my patients, and they're buying into it slowly but surely. For the last month or so, I've just been giving them introductory steps on how to embody these principles. So today I thought I'd just dive deeper into the breathing technique that Wim Hof shows. And the first thing, as you can see on the title, is his name. It's W-I-M-H-O-F. To laugh at myself, I've been calling it H-O-F-F for the last year or so. So yeah, Wim Hof Method. Now, if you look him up on YouTube, he's got great YouTube videos. I was looking at one this week that had 8 million views, and it's only been on air since November 2019. That's about 6 months or so. Amazing, but I'm not surprised, because he is the world leader with this subject of how to optimize your health by reducing inflammation through cold exposure and breathing. So what is this breathing technique I'm going to encourage you today? Well, I've been doing this a lot in the last few days, and it's simply awesome. So let's walk through it as well as talk about it. So the first is you're going to do 3-step breathing in. That's the abdominal focus. So you're dropping your diaphragm as you're breathing in and sticking your belly out. The second step of this, after the exhale, is to use your lateral chest, the side of your lungs here, and you're going to expand it. And then you're going to exhale. And then you're going to do an inhale. And you're going to look up and use the upper part of your lungs like this as you do the inhale. So let's go through it. So deep breath in. You can't quite see my stomach. In fact, let's just move back. You can see this. So stomach, breathe in. Let's stand up a bit like this. Woo. So breathe in. Belly sticking out. And then just let it go. Little bit of exhale. Then inhale with the lateral chest. And then let it go. And the last one, the upper lungs. And let it go. So it's a 3-step process. And then what you do is you repeat that 3-step process 10 times. So that's your 30 inhalations. Now, word of warning, please do not do this if you're driving. Please do not do it if you're in the bathtub. Do it sitting or do it lying down in bed is the best position. You can expect to feel tingles all over your body. You might feel a little bit lightheaded. And if that is happening to you and it's a concern, maybe it's going to the next step of stimulating your nervous system, you may feel nauseated. I had a patient today talk to me about this. Just back off. Instead of doing 30 of these breaths, because you're going to do 3 multiplied by 10, so 10 cycles of this. Don't do the whole 30, just do a few and get used to it and allow your nervous system to acclimatize to this technique. So not to confuse you, it's the lower half of your lungs, the center part of your lungs, and the upper part of your lungs. So it's 1, 2, 3. And you repeat it 10 times. The tingling is the exciting part because you know it's working. So if you can do that, fantastic. Now, after the 30 breaths, you're going to hold your breath for as long as you can, maybe starting with 30 seconds and then up to 60 or even 90 seconds, holding your breath. And then you're going to take an inhale, and then you go to another 15 seconds. 15 seconds, and that completes that initial cycle of 30. Second set, you're going to repeat. So it's 30 breaths, 30, 60, 90 seconds, holding, and then you're going to inhale and hold it for 30 seconds. Sorry, 15 seconds. And then you're going to repeat it again. So 3 cycles that you do, okay? And then afterwards, you're just going to lie there and enjoy your body. Feel what's going on. Maybe you're going to feel your heart beating. Maybe you're going to feel the relaxation down your back or around your neck. Get in contact with your body. And then after you've finished, back to normal breathing, get on with your day. This will energize you like a little energizing bunny, and it'll probably make you feel good. But it is increasing your mitochondrial function. That's your little energy storehouses in your cells, and you're utilizing energy better, you're utilizing oxygen better. And over time, This will help the physiology of your body. You know, in the YouTube video I was listening to this week, Wim Hof talks about how you are making the cells alkaline in the environment. And that's been related in healthcare studies to reducing cancer cells and optimizing a healthy environment. You know, if you're eating lots of fruits and veggies and salads, that's very healthy for your body. It's producing an alkaline state, and that is what's going on in the cells and the stimulation. So there we go. That's the Wim Hof method, 30 breaths times 3. And you're going to repeat that if you can, if you've got time, 3 times a day, morning, afternoon, night. On his website, you look up Wim Hof, you'll see a free app that can help you with this if that's an additional tool that you need. But if you've got time to do this, I strongly encourage you to dive in and get going with the breathing fully. And if you can only do it once a day, that's great. Just do it once a day. And don't remember the cold showers, which you can relate to in other videos that have been done in previous weeks. So that is the Wim Hof breathing technique. You can watch it on YouTube. You can see it on an app. You can watch this video again and go over it again. But the best thing is just to try it, experiment, see how it feels, and develop your own personal journey with it. So there you go, a completely free technique, and it's exciting because it's oxygen that is driving this body at the end of the day. It's oxygen that gives life to every cell, and if we're utilizing our oxygen more efficiently, we can only be healthier. And I believe, as Wim Hof teaches, reduce inflammation and reduce pain as one of the benefits for your health. So I hope you like this. Please leave a comment. It's good to see you. Thanks for hanging in here for the short duration. I look forward to next week. I'm going to do another live stream on yet another subject that can help you on your journey with chronic pain. Thanks for now, and all the best.